Another report, over 700 staff at just one Detroit area health system have tested positive for COVID-19, and the CDC reported over a month ago that over 9,000 healthcare workers had already contracted COVID and dozens have died. And I checked with my Tampa Bay area health providers, and one Tampa hospital said N95s are still very difficult to procure. She said there's a dire need for N95s. One of my community health centers says we continue to struggle to get N95s. And there's so many folks trying to sell knockoffs. And then a large Tampa Bay area health system said the supply chain remains inconsistent and irregular, and BARDA remains concerned as we head into the fall for N95 masks. The demand will continue to increase due to the flu season and the continued presence of COVID-19. Dr. Bright, you understood that America would face a shortage of respirators in January. Is that right?
We understood America would face a shortage of N95 respirators for a pandemic response in 2007. And we have exercised and known and evaluated that number almost every year since 2007. It was exercised even as late as early as 2019, August, in Crimson Contagion, that we would need 3.5 billion N95 respirators in our stockpile to protect our healthcare workers from a pandemic response.
And you sounded the alarm repeatedly, but were ignored by the senior leadership at the Department of Health and Human Services. Please explain what steps you took and the response you received.
We knew going into this pandemic that critical medical equipment would be in short supply. I began getting alerts from industry colleagues in mid and late January, telling me that from an outside view, from the industry view, that the supply chain was diminishing rapidly, telling me that other countries that we relied on to supply many of these masks were blocking export and stopping transfer of those masks to the United States. I learned that China was trying to buy the equipment from the United States producers to have it shipped to China so they could make more. In each of these alerts, and there were dozens of these alerts, I pushed those forward to our leadership in ASPR, to Dr. Kadlik and his senior leadership team. I pushed those warnings to our critical infrastructure protection team. I pushed those warnings to our strategic national stockpile team, who has the responsibility of procuring those medical supplies for our stockpile. In each of those, I was met with indifference, saying they were either too busy, they didn't have a plan, they didn't know who was responsible for procuring those. In some cases, they had a sick child and would get back to it later in the week. A number of excuses, but never any action. It was weeks after my pushing that finally a survey was sent out to manufacturers or producers of those masks, a 5-page survey asking producers or companies if they actually made those masks.
In your whistleblower filing, you discuss a February 7th meeting of the department leadership group at which you urged the department to focus on securing N95 masks. Can you describe what happened at that meeting?
They informed me that they did not believe there was a critical urgency to procure masks. They conducted some surveys, talked to a few hospitals and some companies, and they didn't yet see a critical shortage. And I indicated that we know there will be a critical shortage of these supplies. We need to do something to ramp up production. They indicated if we notice there is a shortage that we will simply change the CDC guidelines to better inform people who should not be wearing those masks, so that would save those masks for our healthcare workers. My response was, I cannot believe you can sit and say that with a straight face. That was absurd.
In fact, it took 3 months from your initial warnings until mid-April for the federal government to invoke its authority under the Defense Production Act to require the production of millions of more N95 masks. And even then, the administration required the production of only 39 million masks, which is far fewer than you and other experts said that we would need. What was the consequence of this 3-month delay and inadequate response? Were lives endangered?
Lives were endangered, and I believe lives were lost. And not only that, we were forced to procure these supplies from other countries without the right quality standards. So even our doctors and nurses in the hospitals today are wearing N95 marked masks from other countries that are not providing the sufficient protection that a U.S. standard N95 mask would provide them. Some of those masks are only 30% effective. Therefore, nurses are rushing in the hospitals thinking they're protected, and they're not.
Thank you for your courageous effort.
Gentlewoman's time has expired. A pleasure to recognize